I'm on my hands and knees, crawling on the floor in a maximum security prison in the middle of the Arizona desert. I'm not a criminal, I'm a doctor. It's 2013 and I'm a disease detective in the Epidemic Intelligence Service at the Centers for Disease Control and Prevention. I'm inside this prison because there's a disease outbreak here. Something is spreading through these cells and it's paralyzing these men. I'm talking about young, burly dudes. They're doing push-ups 1 minute and they're frozen the next. Some can't even breathe. And it's my job to be here to figure out what's making them sick, what's spreading through this prison. It's why I'm on the floor looking under a metal toilet bowl, wearing a stab vest that's 2 sizes too big, a face shield and a helmet that the warden says I have to wear just in case. To do my job, I have to get smart and stay calm. That's the only way I'm going to find out what's going on here. Hunting for diseases will take you to the weirdest places. Places like Dallas. So let's go to Dallas. It's now 2014. It's the fall. I'm no longer crawling on prison floors. Now I'm a professor of public health at the University of Texas at Dallas and a reporter at the Dallas Morning News. And it's a Monday in September, so I'm just at home, relaxing, watching TV in the evening when I hear, bing! It's my husband's cell phone. He looks at his phone, looks at me, and says, I just got an alert on my NBC5 app saying there's potentially a patient with Ebola in Dallas. And then he looks at me with a really smug look on his face and says, you might be the reporter, but I'm breaking news to you now. And I'm like, hold up, dude, let me see your phone. It's hardly likely to be Ebola. If someone's been in West Africa and they have a fever, they may have malaria, they're more likely to have something like typhoid. And I know this because I'm the expert. The next morning, I'm in the newsroom at the Dallas Morning News. And just before noon, someone says to me, the CDC is sending a team here to Dallas. A small team, but they're sending a team. And I've worked with the CDC. I'm watching this situation closely. I know what this means. This means I am so wrong. This means we have a patient with Ebola in Dallas. Ebola in Dallas? We're talking about a virus that has never been diagnosed in the United States, ever. A virus that usually strikes rural, tropical villages in Central and East Africa. A virus that's causing a horrific epidemic right now in West Africa. We're talking about a virus that kills 50 to 70% of the people that it infects. It's here. It's in Dallas. I'm not scared of diseases. When people run away from epidemics, I run towards them. There's nowhere I would rather be than at the center of an outbreak, at the center of the crisis, trying to find out what's going on, piecing together all the bits of information to try and stop a disease from spreading. And hunting for diseases has taken me to small border towns in Mexico, to American Indian reservations, and to this prison. It's why I'm here now, because somewhere in these cells are clues. There are clues somewhere about what's paralyzing these men. I just need to find out what's going on. But I have a problem. The guys that I really want to talk to, the guys who probably know what went down, they're not here in the prison now. They're in the intensive care unit. I need to talk to them. I just need to get some information. So I'm in the ICU. I'm looking at the first patient, young guy. I walk up and he's unconscious. He's hooked up to a life support machine. He's on a ventilator. Okay, so the second guy, the same thing. Unconscious on a ventilator. Third guy, unconscious on a ventilator, and so on, and so on, and so on, and what can I do? What can I do? I'm left with 164 inmates in this section of the maximum security prison that these guys were housed in. And maybe they know what went down. But here's the next problem. They don't want to talk to me. They don't like officials, they don't like authority, and here's me with my shiny badge saying, I'm with the federal government, I'm here to help. I have the words officer and detective in my job title. They don't want to talk. Same thing in Dallas. I just moved here. A few weeks after I arrived, Ebola arrived in Dallas. And today is the first day in one of the scariest times in the history of this city. People will now remember Dallas for two things: the assassination of President John F. Kennedy and Ebola. And I need to get answers from some people because I'm a reporter now. I'm calling hospital officials, they don't answer the phone. I'm leaving voicemail messages, they don't respond. I'm calling scientists, I'm calling experts, and some of them even slam the phone down on me. Nobody wants to talk to me. And I'm seeing that my new hometown, Dallas, is full of people who are panicked and scared. People are freaking out. I have questions, but they're saying to me, what does this mean? What does this mean for my family? What does this mean for Dallas? Explain it to me. And it's my job to write in the Dallas Morning News, to make videos, to be on television news, to say, we have to get smart and stay calm. We have to stay calm if we're going to get through this. But do you remember what it was like in Dallas last October? People were panicked, they were anxious, they had questions, they didn't necessarily want to share any information with me. But I'm trained to handle situations like this, situations where people are scared and where they don't want to talk. Because it's amazing what you learn when you're inside a maximum security prison and you need to get these big, tough guys to talk to you. Here's what I do. There's this one guy, this one inmate, he has 666 tattooed on his face in big green letters. We'll call him Bubba. Bubba says, I don't want trouble, I don't want to talk to you though. Bubba, please, these guys are in the ICU. We don't know what's caused this. It could be you next. This could spread. What made them sick? Silence. Bubba, please just tell me anything that you know. And then I accidentally blurt out, and your face tattoos are really scaring me. I'm sorry, miss. I don't want to scare you. It was a drink. A drink? A drink made them sick. Okay, good. Tell me what drink. Liquor. Bubba, where do you get liquor in a maximum security prison? We make it. It's called hooch, or pruno, or toilet wine. Bubba is telling me that these guys have been collecting scraps from their leftover meals, mainly potato and potato skins, putting it into small plastic trash bags and adding in bits of whatever they can get. Bits of bread, pizza crust, ketchup, and water, tying the bag really tightly shut and fermenting it. These guys are making liquor in their cells. And Bubba says if you want to brew it really well, it takes about 5 days. You take that bag, you put it in your crotch, or you put it in your underarm to get it warm. It makes it better. And then he says, you have to treat it like a baby. The bag will start to swell with the gas. You have to open the bag and burp it. And he's looking at my face, and he knows what I'm about to say right now. He says, when the correctional officers are coming towards the cell to flip it, to search it like they do every day, you tie a piece of string real tight to the top of the bag. Hold the string, flush the bag down the toilet. Drop the string, and then as soon as the CO has left the cell, you yank that string really hard, and you hope your toilet wine is still attached. That's how you make toilet wine in prison. Well, guess what? It's also how you make the most powerful, lethal nerve toxin on the planet. Bubba just told me the recipe for botulism, the toxin that causes botulism, that paralyzes the muscles in your face, your head, your body, and even the muscles that allow you to breathe. That's what these guys have inadvertently brewed inside their prison cells, a toxin so powerful that just 1 teaspoon of it could wipe out the entire planet. And they likely did it because they included potato skins, because here's the thing, the bacteria that makes this toxin lives in the dirt, and we're exposed to it all the time. We don't get sick all the time. But when you take that bacteria and you put it in that kind of environment, in that trash bag, where there's very little oxygen and there's just the right amount of acid and sugar and salt, the bacteria starts to spew out this nerve toxin. That's how the guys became paralyzed. That's one way a killer disease can spread. What about another way? What about in Dallas? Well, it turns out that that first Ebola patient in Dallas was sent home from the hospital that first time that he went there. And then it's likely that a physician in the emergency room didn't take a proper history from the patient, didn't extract the information that was really needed. And then healthcare workers who were looking after the patient, they didn't have the right guidelines and the right equipment to protect them as they did their job. And we know what happened next. The patient died, and 2 nurses who cared for him, they become Ebola patients themselves. And Dallas becomes more scared. America is watching us, and America becomes more scared. And now I'm on television news 4, 5, 6 times a day. I'm on NBC5. I'm talking to Anderson Cooper and Wolf Blitzer about what's going on in Dallas. My editor says that I am the voice soothing America. But really, I am determined that we don't let fear get in the way of compassion. I'm determined to empower through information, to say, get smart, stay calm, we will get through this. And you know what? Dallas will get through this in a way that makes us even stronger, in a way that makes this city even greater than it already is. And looking back, being inside that prison prepared me for this. Because do you know how we stopped the epidemic in the prison? I talked to the deputy warden, and he bans potatoes. He bans potatoes, and the problem goes away. Same thing in Dallas. Okay, not as easy as banning potatoes, but the solution was straightforward. Because here's the thing. We didn't have an epidemic of Ebola in Dallas. We had an epidemic of fear. And the solution to that was to get smart, to stay calm. And we did. America got smart. The CDC assembled a SWAT team to go wherever there might be a patient who potentially has Ebola. Dallas got smart. We got ready just in case there was further spread of the disease. Get smart, stay calm. Whether you are on all fours crawling through a prison in the desert, or you are in the midst of an unprecedented Ebola crisis in the middle of Dallas. That's my message to you today. Get smart, stay calm. I'm Dr. Seema Yasmin. Thank you.